Hello, I'm Professor Jan Pawel Andrade Pachnicki, and it's a great pleasure to share with you this video abstract of our manuscript entitled Introducing a New Hypothesis in the Genesis of Breast Cancer and an Integrative Review. Breast cancer is the second most common cancer among women worldwide. 2.3 million new cases and 670,000 deaths has occurred in 2022 present the disease as a serious public health problem. Estrogen is currently identified as one of the main agents involved in the initiation of breast tumors. However, evidence indicates some inconsistencies. A greater risk of breast cancer was noticed when estrogen replacement was combined with progesterone in WHI, whereas its isolated use does not represent a significant risk. And what's the problem? The progesterone receptor estrogen receptor crosstalking. This raised the question, why do women on combined HRT show a higher incidence of breast cancer if progesterone was originally hypothesized to deactivate estrogen receptors, thereby reducing estrogen's proliferative action and lowering the risk of tumor development? And these inconsistencies in existing theories highlight the need for further detailed research on the relationship between hormone exposure and breast tumorigenesis, with particular emphasis on fibrinogen and its components in the context of this review. Therefore, the objective of the research was to introduce a new theory into the medical literature concerning the genesis of breast cancer. This is an integrative review, literature review, based on a selection of relevant articles published between 1995 and 2024 in both Portuguese and English, and sourced from the main database. After identifying contradictions in current theories about the influence of estrogen on tumor proliferation, which encouraged the search of new interpretations, it was demonstrated that free estrogen and its byproducts, such as fibrinogen-related protein, such as fibrinogen-like protein 1 and 2, play a role in the immune system's failure to contain malignant cells, opening another field for therapeutic research for breast cancer. The authors thank the editors and hope you enjoyed reading this review. Thank you.